So my story started in 1998 during the Asian financial crisis when our economy collapsed, pushed Suharto out of power, and poverty increased very dramatically from 11% to about 24%. Since then, Indonesia has been doing quite good, making a lot of progress. Poverty has reached a single digit by 2018, which is a big success story from the current government. However, poverty increased through the pandemic by about 0.5 percentage point, or about 1.3 million new poor people. And this has wiped out Indonesia's poverty reduction effort during the last 3 years. In addition, 3/4 of Indonesian families experience a fall in income, and half of the workers who switch job move into informal sector. With this increased vulnerability, households have experienced food insecurity double from about 5% to close to 11%. And to mitigate the pandemic's negative impact, in 2020, the government rolled out a special budget to broaden its social assistance programs, both in size and also in scope, to the existing social protection programs such as conditional and unconditional cash transfer, health assistance, food distribution, especially in the broader Jakarta, because there was a shortage of supplies at that time. In addition, we also introduced an ad hoc program such as the village cash transfer, electricity subsidies for 31 million families, and job training programs to reach those beyond the bottom 40% in our current social registry. And the value of the existing program has also been increased, while targeting, as Professor Rima already mentioned, for additional non-regular program are targeted using a mixed methods like a community-based targeting. This is for the village cash transfer. This is also based on the study done by Rima and Abhijit many years ago, published in the AER, about the importance of involving community in targeting those in the bottom 10% of the population. We also used administrative data for those working in the formal sector, especially those with salary less than 5 million a month, for additional about 4 months assistance. And we also use an innovative program called pre-employment card using self-targeting. This is a project that we are currently working also with Professor Rima. Government also introduced assistance for the small and medium enterprises. In total, we spent, prior to the crisis, we spent about 0.85% of our GDP for social protection, translated into about 134 trillion rupiah, to about 1.6% from GDP, which is about 250 trillion. This is a lot of money. And our colleague from SMERU estimated that 75% of the potential effect of the pandemic on poverty has been mitigated by the social protection program. And the good news is that our economy has slowly recovered. Last year, our third quarter annually grew about 3.4%. Poverty fell slightly, but still higher than pre-pandemic process. And finally, in terms of the lesson learned that we can take away from this exercise, at least there are 3. Number 1 is that the dynamic social register is needed so that benefit could be dispersed more accurately and efficiently. This entails expanding the coverage of the existing social safety net to those beyond poor 40%, because everybody got hit, even those who usually work in the formal sector. And this will allow government to institute a more flexible social protection system that allow coverage to be expanded during the shock. Secondly, while the COVID-19 social safety net program are set to end soon, there is a need to keep protecting vulnerable groups, especially women, disabled, elderly, children, and those who are vulnerable to receive the social assistance. And finally, acknowledging the government's limited resources, there is a need to also engage with the local actors, private sector, NGOs in social protection program implementation. And lastly, I think this is the importance of using evidence, whatever is available, even everybody is in rush, that we have to respond quite quickly, but we have learned a lot. I think this is the importance of knowledge generation, knowledge production from colleagues in the universities like Harvard or MIT or everywhere in the world, so that it's no perfect evidence, but at least that's what we can use to mitigate this, perfect storm that everybody is actually not well prepared about this pandemic.